Today I wanted to talk a little bit about my process of researching and learning about my diagnosis. When I was first diagnosed with breast cancer, I was basically cancer ignorant. I knew very little about cancer in general, let alone my specific type of breast cancer. When I first arrived at the Cancer Treatment Center, I was given this big book, Your Breast Cancer Treatment Handbook. And there is information in here about triple negative breast cancer, but not a lot. And then I was given my pathology report from my biopsy, and there was a lot of terminology and things on there that I didn't exactly understand and I wanted to learn more about. So for me, I decided it was time to educate myself. I went to the internet and started doing research there. And there are definitely good sources out there, but there are also what I would call peaks and valleys of information, things that make me hopeful when I read them. One thing in particular was a blog of another woman who was diagnosed at 31, and she goes through her entire treatment process, and she's actually now pregnant. So that one for me is a peak. As far as valleys go, I would say forums. I don't follow any particular forum, but I do read them when I hit upon them. You know, if I type in a certain search and I find a forum, I will read all of the posts. So if there's 10 pages worth of posts, I'm going to go through and read every single one, even if they're all negative. So sometimes that's hard, but it definitely doesn't deter me from going back and spending hours online, getting lost in reading different things, what's out there, the studies that are going on. I also got my doctor, Dr. Stoutenberg's opinion on patients doing research.
I think the internet in general is a great thing, but you have to be careful. And so I think like most physicians, probably have mixed feelings about patients getting on the internet. There are certainly lots of great sites that we use and that patients use as well. But there's also some misinformation out there that you have to be careful about.
I also have an entire backpack filled with information that I've been given throughout all of my appointments. It's an insane amount of information. And I can say that I have read it all. I just feel like it's important to know what's being said out there and educating yourself as a patient. You're your biggest advocate. You have to know what's going on with your body so that you can ask the right questions and make the best decisions for yourself.